I gather that a lot of you have already seen our website and know what we do, but I'll just quickly explain who we are. We're the NET Patient Foundation, which is the charity that supports NET patients throughout the UK and Ireland. It actually sort of came out of the Royal Free, really. Cathy Bouvier, who many of you will know, was the first NET specialist nurse in the country, in fact, and she was working at the Royal Free and just had such a huge amount of requests from people who weren't being treated here and weren't getting the same level of treatment, who were worried about what was happening to them, that she realised there was a huge demand for you know, people who aren't necessarily within the best NET centres in the UK, although obviously we offer support to everybody. Which one is it that I...
That one, yeah.
So just quickly, these are our aims. You probably can't see that from wherever you're sitting, but basically to provide support and education for anybody affected by neuroendocrine cancer, because we know that, you know, that's patients as much as family members and friends who are sort of worried when there's a diagnosis. We also, increasingly, our aim is really to advocate for neuroendocrine cancer patients, and what we mean by that is to make sure, it's all about raising public awareness and making sure that everybody who's diagnosed with a NET in this country gets the best possible care that they can, and whether that's existing care or whether there's anything we can do to improve on the existing care. That's what we aim to do, and also we do raise funds for clinical research projects as well, including Professor Kaplan was talking about the translational research, where all of the NET researchers in the country basically get together to make sure that they're all kind of singing from the same hymn sheet and using patient data from all of the NET centres. So that's something that we support as well. If you haven't visited us online, please do. I've got some leaflets over here that you could take away with you. We've got a website with lots of information on it, patient forums if you'd like to meet other patients online and have chats either in your region or on other topics and that kind of thing. If you're into social media, we also have Facebook pages and Twitter and that kind of thing. So do check us out. Again, on the patient support side, we do have a helpline which is manned by Cathy, so she knows what she's talking about, and she's there sort of 5 days a week to answer people's questions. She'll also answer emails if you've got any concerns and want to speak to her. And again, as I say, we've got the social media and forums. We also run patient education events, a bit like this one, but thank goodness Jorge is here to do it in London for you guys. And we've also got something new that's just set up recently around the country, which are what are called NET Natter groups. So they're very informal, kind of, often they take the form of a coffee morning or something like that. And there are now NET Natter groups kind of everywhere, but not in London. So if anybody would like to set one up, you know, probably talk to Jorge about it, but also we can help to support that. You know, might just be a sort of monthly informal meeting. Perhaps, if you're interested. This again on our website, we've got regional support now in all parts of the country. So it's not just you lucky guys in London who have the great support. Do have a look online. We're just producing, we've just updated all of our patient information, and you know, even if you've been a patient for a long time, you might find something of interest up there. We've now got leaflets on all the different types of NET, but then also on the tests and the treatments. We've got a travel tips leaflet there with some not very helpful advice about travel insurance as well. Although I would quickly say on that point, you did make the point, Mark, but people find that they find it very hard to get travel insurance to cover them for your neuroendocrine cancer, but many people travel accepting that they're not going to be covered for the NET, but can be covered for everything else. So if you're feeling that you're quite confident about travelling in terms of your NET, don't let it stop you necessarily, because a lot of people do it, and you know, if you think it's unlikely that anything's going to go wrong, then you know, don't let it stop you. We also have, I've got a few here, these little cards that you can see in the top right hand corner there, little plastic cards to go in your wallet. And one of them is to explain if you have carcinoid syndrome and might need to use the loo quickly. I know that you wouldn't necessarily use a disabled toilet, but if you're suddenly kind of caught short and, you know, just need to show somebody why you need to use a loo, that can be something that really helpful to have in your wallet. Also, we've got the carcinoid crisis card, which if you've been told that you might be at risk from that, it's useful to have in cases of emergency, just you know, so people can see that if you suddenly needed an operation, then they need to know what to do about that. We've also just produced this fantastic video with the help of the Royal Free. Lots of people here are on it, and this is Joe, who actually works in our office and is a patient as well. I've been handing around some USB sticks with the video on them, but it's also available on our website. If you go there, you'll see it on the home page. So do have a look at that. Now, just to get to the nub of what I'd really like your help with. I feel terrible now because everybody's been talking about it as if, you know, you've been prodded and poked and tested on and all sorts of things and asked questions by everybody. But it really is the only way that all of us can actually move things on is by gathering evidence. And the people who can help us gather that evidence are you. And whether that's by, you know, in a clinical setting or being asked questions about you know, how your experience has been, that's how we can make things better, because at the moment there's virtually no data out there. So when we want to go to Parliament and say to MPs, look, there's a real problem, you know, NET patients aren't getting the best deal, they'll say, well, how do you know? You know, tell us how many there are, tell us what the problems are. And unless we've got data that we can show them, they're not going to listen to us. So I'm sure several of you in this room have already completed a few of our surveys, and I'm afraid they haven't quite finished yet. But we've just finished the global survey with the International Neuroendocrine Cancer Alliance, and we did that in conjunction with Novartis. And it's really a patient experience survey, and nearly 2,000 patients worldwide have completed that, which is amazing. I mean, you very rarely get those kinds of numbers talked about in terms of NETs ever. And we've just had an abstract submitted to the European Society of Medical Oncology, which is a huge meeting in Madrid for, you know, all cancer types, and we'll be there with a poster to show our results, which is great. I haven't seen the results yet, so I can't tell you anything about them. We're also just about to send out a survey, which I think all of you will probably get, and you've probably already completed it. It was the Cancer Patient Experience Survey, which has now been done, I think, 2 or 3 times in the UK. And it went out to nearly all cancer patients, I believe, and probably some of you filled it in. The problem with it was that because of the way that NET cancers are coded within the NHS, it didn't capture any kind of NET cancers properly because it was all about site-specific. So your answers may have gone into the pool of questions about, you know, gastric cancer or something like that. So we've used the same survey, but we're sending it out just to NET patients. And we'll then, please, if you have time, when you get it, fill it in and send it back to us, because that will enable us to say, here's the experience of cancer patients, you know, nationwide, and here's the experience of NET patients. And I mean, one of the major findings from the big UK-wide survey was that the experience of people who had a specialist nurse like Jorge was significantly better than that of patients who didn't, and they felt they'd had their questions answered, they knew who to speak to, and it's information like that which enables us to go out and really make a difference. And
when you say sending it out, do you mean Royal Mail?
I believe it's being sent by mail. Yeah.
Where are you getting your database? Your list of names?
It's going to all the NET centres. It's going to basically there's a list of. You know, the patient information is all obviously held by the NHS, and we've got special dispensation to send it out to the patients who are, listed as NET patients. which is what happened with the patient experience survey before. So I don't think they've been sent yet, though. Look out for them. I hope they'll be there soon. We've also just carried out an audit of all of the trusts in the UK just to see how many patients are being looked after within specialist NET centres like this one and how many aren't. And actually we found that there are a fair number of patients who are being treated within ordinary hospitals without NET centres. And, you know, that's something we'll be working to do to make sure that everybody gets seen by a specialist NET centre. I'm going to move on there. This is just back to the importance of specialist nurses, and we're just to say briefly that we've set up a European group of specialist nurses, and we've put together a training pack for them, again, because, you know, it's such an important, you're the real stakeholders, as we say here. You know, it's the nurses who really kind of speak to the patients more than anybody, and that's one of our big focuses at the moment. And there's the NET Nurse newsletter. Now, one other thing you can help us with is, again, Professor Kaplan mentioned last year we did a big event at the House of Lords, which was a great success. We had far more MPs turning up than we expected. And this year we're going to do the same thing again, with all of the regions represented, hopefully by a patient and an MP and a GP from each region. And we'll really kind of focus on what's going on in each of the regions. So if any of you would like to attend, please let us know. Through our website you can find out how to take part in that, because it'll be a great day, I hope. Sorry, that's just the newsletter for that. Fundraising, not treading on anyone's toes here, but we also need plenty of funds to keep everything that we're going done, and that includes research. And I know that several people in this room have run and walked and all sorts of wonderful things. I won't embarrass anyone by naming names, but please do support us as well. And thank you very much. I think that's it. Thank you.